internal genital organ. We start to describe the anatomy of the uterus. The uterus simply can be defined as a pelvic structure, hollow muscular organ lying between the urinary bladder and the rectum. The body of the uterus forms the upper two-thirds of the uterus and overhanging the urinary bladder. The uterus, as you see here, is open into the vagina inferior at a right angle. At a right angle. Here we can see a cadaveric real specimen of the uterus. You can see this is the pear-shaped like structures, and the body of the uterus, as I mentioned, is pierced on the superior surface by the at the lateral angle of the superior surface of the uterus, pierced by the uterine tube. This is the uterine tube. Here you can see this one uterine tube, and this is another uterine tube at this side. The part above the entrance of the uterine tube to the body of the uterus is called fundus. The position of the uterus in majority of the women, we can see that the long axis of the uterus is bent forward on the long axis of the vagina, forming an angle about 90 degrees, and this position is referred to as the anteversion of the uterus. Furthermore, a long axis here of the body of the uterus is bent forward at the level of the internal os here, also in the cadaveric specimen. This bend on the body, from the body of the uterus axis and the internal os axis, forming an angle here about the 170 degree, and this position is called anteflexion of the uterus. So that the term anteflexion is referred to the normal position of the uterus. The uterine tube, here we can see the uterine tube. On both sides, on the upper border of the broad ligament. This is a broad ligament here, you can see. And this broad ligament is attached to the uterus and extends to the lateral wall of the pelvis. And bearing with it structures. These structures include important structure, uterine tube and ovary. The uterine tube, as I mentioned, from the upper border of the broad ligament and open medially into lateral angle of the uterus and divided into many parts. The uterine part here inside the uterus, and the narrow isthmus part, and the dilated ampullary part, which is the site of fertilization between the ova and the sperm, and the funnel shape here we can see infundibulum, and the finger-like process is called fembril. This is ephemeral, and this is the dilated part called ampullary part. The ovary, as you see here, this is the ovary, is an almond-shaped organ having medial and lateral surface, tubal and uterine part or ends, lies on the posterior part of the broad ligament. This is the broad ligament, and we can see the ovary on the posterior part of the broad ligament, and attached to the double fold of the peritoneum, by double fold of the peritoneum to the broad ligament through this mesovarium. Regarding the vagina can be defined as a muscular ridge sheath connecting the external genital organ to the uterus. This is the external genital organ, and this is the uterus. As you know, the function for the either accepting the penis and the sperm during intercourse, and also for passageway for the child birth. The vagina lies behind the following structures: renal bladder, urethra, and in front of rectum. The cervix here you can see projecting here the cervix. This is the external os, cervix. And this part projecting of the cervix project into the upper end of the vagina, leaving a deep sulcus. Here we can see a deep sulcus. The most deepest one is on the posterior surface of the vagina and called posterior fornix. And this all sulcus have posterior, anterior, lateral fornix. All these are produced by projection of the uterus inside the vagina. As I mentioned, the relation of the vagina anteriorly is related to the renal bladder, most important structure, and the uterus, while posteriorly is related to the recto-uterine pouch, of Douglas, in addition to the perineal body here and the anal canal. As we see, it is like a truncated board-like structure, and containing superior surface, posterior surface, and two anterolateral surface. On the posterior surface, here we can see, this is the seminal vesicles, and here we can see the entrance of the ureter through the urinary bladder into inside urinary bladder at superior surface of the base of the triangle called a triangle. And this is the internal urethral meatus, you can see here. And this is prosthetic urethra. Here we can see the prosthetic urethra. which is pierce the prostate gland. And between it and the opening of the ejaculatory duct, here we can see a pyramidal structure called a median lobe. This median lobe may project up into the inside urinary bladder and even sometimes obstruct the internal meatus. And this projection part or projected part called uvuli vesicle. And the prostate. In adult, the empty bladder is entirely located into pelvic cavity and posterior to the pubic bone, and it's separated from the pubic bone by the retrous pubic space of Rentzius. The empty bladder is a pyramidal in shape and like a truncated bolt with important structure attached to it. It has four corners and superior and posterior surface and two inferior-lateral surface. Also, it has a neck and apex. At the apex, the fibrous cord attached to the umbilicus through auricus, which is remains of the anatomies. The superolateral surface on both sides joined by the ureter. The inferior angle gives rise to the urethra. Again, this is another specimen which can see the urinary bladder and its surfaces, superior surface, which is covered by peritoneum, and posterior surface here we can see also partially covered by the peritoneum, and the space between it and the rectum called rectovesical pouch. On the posterior surface, the lower part of the posterior surface, we can see the, as I mentioned, separated from the rectum by the vas differential or vas difference here. And also we can see this is the vas difference, and this is the ureter on the posterolateral aspect of the urinary bladder. The vas difference and the seminal vesicles on both on the posterior surface of the urinary bladder. Also, we can see the rectovesical fascia here, rectovesical fascia of the non-biliary. Rectovesical fascia of the non-biliary. The posterior elevation of the urinary bladder in male, we have a vas difference, seminal vesicles, rectum, here rectum, and rectovesical fascia of the non-biliary. While in female, is separated by the vagina and part of the uterus. the superior relation of the urinary bladder in male is by peritoneum. You can see the peritoneum here, and this part or superior part of the urinary bladder is occupied by the coil of ileum and the sigmoid colon. While in female, the superior relation is by the uterus. The neck of the bladder here, at the neck of the bladder, inferiorly, which lie inferiorly, and in male it's rested on the superior surface of the prostate gland. While in female, the neck of the urinary bladder resting on the urogenital diaphragm. If we see the inside the urinary bladder, we can see the internal surface here. The internal surface of the urinary bladder is one or torn into fold. This fold is called Woodhees-like structures, and this is when we see this folded, we can see or we can imagine that this part or this structure or organ can be distended. On the base of this region of the urinary bladder, we can see this white area here. It's called the triangle. Here we can see it's a mucous membrane. It's always smooth, and even when the bladder empty, because it's firmly adhered to the underlying muscle cord. The superior angle of the trigon corresponding to the opening of the ureter. Here we can see this is the two opening of the ureter. The inferior angle here is corresponding to the internal urethral meatus. The trigon limited above by the muscular ridge. This is a muscular ridge-like structure which runs between the two openings of the ureter. This is called interureteric bar or interureteric ridge. Sometimes an elevation here from the enlarged prostate gland located immediately behind the orifice of the internal urethra, and this called uvuli vesicle, which is produced by the underlying enlargement of the median lobe of the prostate gland. Regarding the prostate gland, the prostate is the male organ. It's roughly or can be described as an like chestnut with apex below and base above. It lies between the bladder, urinary bladder, above, and the urogenital diaphragm below. It has a base, apex, anterior and posterior surface with two lateral surfaces. The base is located superiorly and related, as I mentioned, to the urinary bladder. The urethra enter here, we can see the urethra enter the center of the base of the prostate. The apex lies opposite the base and directed inferiorly on the upper surface of the urogenital diaphragm. The urethra leaves the prostate, as you see here, just above the apex on the anterior surface of the prostate. The rectovesical septum, which is act as a barrier to the reciprocal spread of the prostatic or rectal disease, and is more loosely attached to the prostate than that of the rectum. On the posterior surface of the prostate, here we can see two structures related to it, which is a vas deferens and the seminal vesicles. The vas deferens is a thick wall, muscular tube, which convey the sperm to the epididymis, from the epididymis to the vas, and they enter the abdomen at the deep inguinal ring. At the posterior surface of the bladder, it hooks over the ureter, so that the term water under the bridge, here we can apply this term to this region. The term is then turned medially to approach its opposite fellowship. The terminal part of the vas is dilated. Here we can see the dilated part called ampullary part or ampulla of the vas. The inferior end of the ampulla is narrow and joined by the duct of the seminal vesicles to form collectively an ejaculatory duct. Ejaculatory duct which open here, ejaculatory duct open into the prostatic urethra. The seminal vesicles, here we can see on posterior surface of the urinary bladder, are two lobulated sacs. Their upper end is widely separated from that of the lower end. The lower extremities of these lobulated seminal vesicles close together and they narrow to join the vas deferens at the ejaculatory duct. The prostatic urethra here, it is a distensible part of the urethra, most widest part of the urethra. What is the most what is the widest part of the urethra in general, and what is the most distensible part of the urethra is the prostatic urethra. It extends from the internal urinary meatus here to the anterior aspect of the prostate, just above the apex of the prostate, and is continuous as a membranous urethra, then down into the benign urethra. The prostate gland can be simply divided into many lobes. These include the lateral lobes, two lateral lobes, and a median lobe. Two lateral lobes and median lobe. The pyramidal shape of the median lobe that is located between the prostatic urethra and the ejaculatory duct. This part of the prostate is called median lobe or middle lobe. In case of enlargement of this middle lobe or median lobe, many project upward and into the bladder and forming a swelling-like structure, which is narrowing the urethral orifice, or sometimes even close this urethral orifice, and this part or this region called uvulae vasae. Uvulae vasae. First of all, we describe the topography of the sacrum. The sacrum in general consisting of the 5 fundamentally fused sacral vertebra, and on both sides of these sacrum, anterior sacral. Here we can see the first step of the this part is called of the sacrum. On both sides of this vertebra, we have an A and here we can see the superior articular facets. When you take an oblique and flat view of the sacrum, view of the sacrum, we can face with the following structures. Here we can see the promontory. Here the auricular surface for articulation with the ilium to form the iliac joint. Here we can see the coronal, and this is the sacral hiatus. And this is the sacral canal. In addition to that, you can see there is a posterior sacral foramen. And this is located on both sides of the median crust. There is another crust here in this region called the lateral crust. Of the sacrum. Regarding the body pelvis, we can see the pelvis consisting of the articulation between the ilium and sacrum through sacroiliac joint. This is a synovial joint, and it is bounded anteriorly by the symphysis pubis and posteriorly by the sacrum and coccyx. The sacroiliac joint, the stability of it is provided mainly by a ligament. especially strong posterior interosseous sacroiliac ligament, which suspended from the sacrum through these two iliac bone. In addition to that, the stability of the sacroiliac joint occurs by the presence of the another ligament, accessory ligament, which is including the iliolumbar ligament, this is the iliolumbar, sacrotuberous ligament, and sacrospinous ligament. The pelvis can be divided into two parts: the false pelvis and the true pelvis. The false pelvis demarcating by the pelvic inlet, which is demarcating by the superior pelvic apparatus, while the pelvic outlet demarcated by the inferior pelvic apparatus. The pelvic cavity is the area between the inlet and outlet. Between the inlet and the outlet is called pelvic cavity. The wall of the pelvis, the posterior wall, as I mentioned, is consisting of the two bones, sacrum and coccyx, while the anterior wall consisting of the symphysis pubis, superior pubic rami, inferior pubic ramus, and the body of pubis. The pelvic inlet consisting of the line that join the following structures: the promontory of the sacrum, area of sacrum, and arcuate line of the ilium, pectineal line, and pubic crest, and lastly the symphysis pubis. All these structures mentioned consisting a line. This line is called linea terminalis, extending from these structures mentioned from Y. The pelvic outlet, as you see, this is the pelvic outlet, is not in a single plane. It is consisting of two planes that join the coccyx from ischial tuberosity, and also from the ischial tuberosity to the symphysis pubis. This is another line. The pelvic outlet, as you see here, it is diamond shape, consisting of the symphysis pubis, ischial pubic rami, anteriorly, forming the boundary in front, while in the behind structure. We can face with the ischial tuberosity, sacrotuberous ligament, which forming the boundaries behind and coccyx, so that it is diamond in shape. Again, I repeat the boundaries, symphysis pubis and istiopubic rami, forming the boundary in front, and the coccyx with the sacrotuberous ligament forming the boundaries behind, the all collectively forming the pelvic outlet. The position of the pelvis in general, you can see that the pelvis plane of superior pelvic apparatus, in this region, is forming about 50 to 60 degrees with the horizontal plane. So that this is the exact location of the pelvis, slightly inclined, and the anterior superior iliac spine, with the symphysis of pubis, anterior superior iliac spine, and symphysis of pubis, lying in the same vertical plane. Regarding the pelvimetry, we can see that the pelvis consisting of the many directions, and this is measured by either plain X-ray or nowadays using the CT scan or MRI. The MRI is the most dominant device that used to measure in pelvimetry. First of all, the anterior posterior diameter of the pelvis, which is the line joining the mid-promontory to the upper surface of the symphysis pubis. It is about 11 centimeters. Another dimension is the transverse diameter. This is the transverse diameter joining to linea terminalis, and it is about 13.5 centimeters. The oblique diameter that joining the ischiopubic rami, third the opposite sacroiliac joint forming an oblique dimension or diameter, and it's about 12.5 centimeters. The term true conjugate diameter is same to that of the superior pelvic apparatus or anteroposterior diameter. And this is from the tip of the promontory of sacrum to the superior part of the symphysis pubis. The term diagonal conjugate, which is from the inferior border of the symphysis pubis down the promontory of the sacrum. And this is the line joining these two parts is called diagonal conjugate diameter. It is about 1.5 centimeter greater than the true conjugate diameter. This is also can be performed by PE examination. What about the outlet, the pelvic outlet? Here in this case, the anteroposterior diameter here, pelvic outlet, is about 13.5 centimeters, while the distance between two ischial tuberosity, this is the ischial tuberosity, two ischial tuberosity, forming the transverse diameter, which is about 11 centimeters, while the oblique diameter, also same in that of the inlet, about 12 and half centimeters. The least pelvic dimension or diameter is between two ischial spine. So see here, this is a red color area. Is the ischial spine. Two ischial spine. This is the least pelvic dimension or diameter. And this is about 9.5 centimeters. Regarding the muscle of the lateral pelvic wall, we have Python muscle, which is not present here in this specimen, which originating from middle 3Ds of the sacrum toward the lateral trochanter of the femur bone, and another muscle which is called obturator internus. This is the obturator internus muscle. This muscle form also by pelvic floor, which is forming by two muscles, the pelvic diaphragm or pelvic floor, and this is including the levator canine muscle and coccygeus muscle. Levator canine. This is the levator canine muscle, and this is the coccygeus muscle. These two muscles forming the floor of the pelvis. The pelvic diaphragm, the composed of on each side, as I mentioned, by these two muscles, the levator canine and the coccygeus muscle. Also, we can see the levator canine may take its origin from this tendinous arch which is regarding as the beginning of the fascia of the obturator internus muscle. This is called a white line or tendinous arch, which is here. You can see this is the tendinous arch, and this gives origin to the levator canine muscle. We have many types of pelvis, either gynecoid, which is most common type of the pelvis, and this is a female pelvis, and another type called the android pelvis. This is the android pelvis, or male pelvis, and another part or another type includes the anthropoloid and litiphiloid. Anthropoid and litiphiloid pelvis. The main difference between male and female pelvis, the first point includes the shape and thickness, heaviness of the bone marker, which is very well developed here in male pelvis, while it is light and thin in case of female. Other points would be articular surface here. In male is well large and well marked. Here you can see the sacrum and iliac joint is large, while here in female it is small. The muscular attachment in case of male is well marked muscular attachment, while it is indistinct in case of female. The false pelvis here in case of male is deep false pelvis, while in case of female is shallow false pelvis. While the pelvic inlet is heart-shaped in male, while in female it is oval-ish. The pelvic outlet is relatively smaller than that of the female. The female is larger than that. The subpubic angle here is less than 90 degrees in male and can be represented by the forefinger and middle finger, while in case of female it is more than 90 degrees. Can be represented by the thumb and forefinger. The inferior pubis is depicted for the presence of the cusp or corner of the penis, while this is not present in female. The scapula is large, while in case of female is small scapula. Larger than that of the female. The SCL tuberosity is inverted in case of male, while it is inverted in case of female. The obturator foramen is smaller in or triangular shape in case of female, while it is oval or large the SQL tuberosity, sorry, the simplicity pupils in male is smaller than that of the female. Regarding the mechanism of the labor, we can see first of all if there is any disproportion between the head circumference and the pelvic inlet. The baby almost always is searching for the largest diameter to be passing through the pelvic inlet. And in case of the largest diameter, pelvic inlet is the transverse diameter, about 13.5 centimeters, while the anterior posterior diameter here is about 11 centimeters. So that the head of the baby descends down due to contraction of the anterior abdominal wall muscle and the muscle of the uterus, so that it's descends down to the pelvic inlet, through the pelvic inlet into the pelvic cavity or static pelvis. After that, due to contraction of the pelvic diaphragm and the presence of the amniotic fluid surrounding the baby, make it in a flexion position to be being rotated into occiput anterior, and by this way passes through the largest diameter of the pelvic outlet. And the largest diameter of the pelvic outlet here is the anterior-posterior diameter, so that it passes through occiput anterior here, and flexion of the head, then rotating its undergoes after delivery on this outlet, rotation laterally, and then delivered outside the body. Regarding the peritoneum of the pelvis, here in case of male, the peritoneum descends from the sigmoid colon down to the rectum, the sigmoid and the rectum. In the rectum can be divided into three parts, or three curves. The first curve includes the anterior and on both lateral side of the rectum, while on the middle curve only covers the anterior aspect of the rectum, while the posterior curve is removed from the peritoneum. After descending of this peritoneum, it passes toward the posterior aspect of the urinary bladder. Here we can see it is likely cover the vas deferens and the seminal duct. From the upper edge of the back of the bladder, the peritoneum covers the upper surface of the bladder, and here descend on both sides to forming what we call it a paravesical pouch, which passes toward the pelvic wall. Then it runs forward toward the anterior abdominal wall. Usually here we can see the area between the peritoneal area between the rectum and the urinary bladder is called rectovesical pouch. Rectovesical pouch. This pouch is usually contain a loop of small intestine or sometimes sigmoid wall. In case of female, the general arrangement of the peritoneum described in male is the same, but it containing or accepting the presence of the uterus and the vagina. Uterus and the vagina is intervening between the structure mentioned in male. The peritoneum leaves the rectum and passes on the posterior aspect of the upper third of the vagina. This is vagina, and we can see the uterus passes through the upper part of the vagina, leaving fornix, and this is the posterior fornix of the vagina. So that it runs over the posterior fornix, the peritoneum runs on the posterior fornix of the vagina, the posterior surface of the uterus, and being forward onto the two-thirds in front of the uterus. After reaching the uterus, the peritoneum, on each side, a double fold of the peritoneum passes to the lateral border of the lateral pelvic wall, forming what we call it a broad ligament. This broad ligament containing the uterus, uterine tube, ovaries, and round ligament of the uterus. There are two pouches in case of female, the deep recto-uterine pouch of Douglas, recto-uterine pouch of Douglas, and utero-vesical pouch, The pelvic fascia can be either parietal or visceral fascia. The parietal one that line the pelvic wall, and the above pelvic inlet continuous with the fascia lining the anterior abdominal wall. Superior fascia of the pelvic diaphragm here you can see in the pelvic diaphragm, and the inferior fascia of the pelvic diaphragm. While the visceral pelvic fascia is a loose and for supporting the organ concern. Sometimes we can see the fascia is very thin and loose in case of distensible organ lining it, like urinary bladder or uterus, while sometimes in case of prostate it is very dense and thick.